Nursing should have never been a degree. It's practical. Why do you need a degree when all you do is change sheets and wipe off?
I cannot tell you how many times I have heard this. Sometimes as blatant as that, or on most occasions, a little more passive. There is no right answer to the question of what nurses do. If you ask a community nurse, they will give you a completely different answer to a ward nurse, a practice nurse, a psychiatric nurse, or a nurse like me in critical care. We also disagree with each other about what nurses should and shouldn't do. An accurate reading of how much air we should push into someone's lungs is crucial to critical care, or when someone is on the maximum dose of noradrenaline, because this informs the decision-making on a patient's life or death. However, a practice nurse will not need to know this because they will not see people on a constant infusion of noradrenaline. Conversely, a critical care nurse will not have the knowledge and skills to manage a complex pressure sore or a leaking ulcer, as they are not part of the day-to-day practice. Simply, all nurses are caregivers. I feel this is the easiest to understand as it is the most used depiction of a nurse. Providing bedside care in one way or another, we physically care for someone whilst promoting dignity and protecting privacy. A nurse acts as the go-between for all the different specialities, working together as part of a multidisciplinary team. When I was in critical care, one of my main jobs was to make sure that everyone was on the same page and no speciality was going rogue. I would also be the gatekeeper and protector of the patient. If I believed strongly enough that the patient was too unstable for physiotherapy to mobilise them, I would advocate for the patient's safety. I would also be the eyes and ears for the consultants and had a voice during the medical rounds, the team of doctors planning the next step of treatment. I also, alongside the medical team, tried to translate all the jargon so that the patient and their families or loved ones could fully understand what was going on and why it was happening. In order to be a good communicator, I had to be above average in reading body language, have an above average understanding of anatomy, physiology and pharmacology, and also empathise with the people who I was communicating with, no matter who they were or what their background was. Whether it be taking on a student nurse for the day, teaching a service user about a new medication or treatment plan, teaching a family about how they could help their loved one, my role as a nurse was to educate. I also educated people who were against vaccinations and managed, with a few, to encourage them to be vaccinated. This was a very large part of my role as a critical care nurse. Because my patients were mostly in medically induced comas, I had to act as their advocate to make sure that I was putting their needs first. This could be as simple as making sure that their sedation and pain relief was enough to make them comfortable, but not too much to cause harm. If I believed that a course of action was too dangerous, like discharging someone before they were truly better, I would also voice my concern. Even though reflective practice and evidence-based practice are separate to each other, I have combined them because the role of the nurse is not just to keep up to date with the latest research and constantly evolve their practice, it's also to be reflective on their current practice and evolve through reflecting on what they do. The traditional leader role would have been a ward sister or matron. In the present day, a whole clinic or unit can be nurse-led rather than doctor-led. Most nursing homes, given their title, are run by nurses. Also, the nurse will lead by example by acting as a role model or by keeping calm and professional in a very challenging situation. When I was a student on my first day in critical care, my main observation was how calm everything was. This was largely due to the demeanour and nurses I saw and looked up to. In conclusion, a nurse does many things. The role of a nurse is complex and varied and would take 20 of these videos to fully explore. I see this as a positive because it means that it doesn't just take one sort of person to be a nurse, and nursing doesn't just have to be one thing. It can be a myriad of different things. I hope you've enjoyed this video. Please like and subscribe, and until next time, it's bye from Loki, bye from Ophelia, and bye from myself, the eccentric nurse cat dad.